born in Ottawa, Ontario, Canada, the capital city of Canada, which a lot of Americans don't know. And did not grow up there, however. And when I was 6 years old, my parents decided to load up our station wagon and move south, and ended up in Minnesota. I grew up there, went to high school, went to the University of Minnesota for medical school, and stayed there to do my pediatrics residency and chief residency. So in all, spent 12 years on the University of Minnesota campus before moving out to the West Coast to do my pediatric GI fellowship at UCLA. There was a great opportunity here in Las Vegas at the time. There was only one pediatric gastroenterologist in the entire state of Nevada. Her name was Sharon Schaefer, and she had sent out through Sunrise Hospital, in fact, a blast fax that ended up in my hands at UCLA saying, you know, come check out Las Vegas. It's a great place to practice. When I came out, I was attracted to the city, I was attracted to the opportunity, I was attracted to the practice. I remember Sharon Schaefer, in fact, who hired me, said, you know, in 5 years, if you wanted to, you could be chief of staff at a hospital here. And I kind of thought, no, because I was used to medical communities in which you had to, generations had to go by before you would ever really be considered for any type of leadership role like that. And so it was, in fact, our friend Ron Klein who first got me involved in the Clark County Medical Society. And Ron called me up and said, hey, how would you like to be on the board of the Clark County Medical Society? And Ron was always a good salesman and, you know, gave me a whole spiel about, don't worry, there's not too many meetings involved, you know, you can be as active as you want to be. And I said, well, okay, sure, put me down. And it's been really interesting to see how policy is created. I'm on the community board for the Crohn's and Colitis Foundation of America that raises awareness, provides patient education, outreach, and support, as well as dollars for research to try and find treatments and cures for Crohn's disease and ulcerative colitis, which are inflammatory bowel disease that 25% of which start in children. Improved Care Now is a what's called a learning health system, and this is a national collaboration of now 70 centers in both the U.S. and Great Britain of pediatric gastroenterologists and practices, whereby we created a large database that's housed at Cincinnati Children's Hospital. You're getting the same level of care that you would get at Boston Children's, at Mayo Clinic, at Northwestern, at Baylor in Texas, Cincinnati Children's, Nationwide Children's, all huge children's hospitals. And we have now 8 of the top 10 children's hospitals in the U.S. that are participating in this, and approximately a third of all the pediatric gastroenterologists in North America participating in this now. I'm an associate professor with a very minuscule percent FTE with UNSOM, and I'm also a clinical adjunct faculty at Touro University Osteopathic School of Medicine here in Southern Nevada. About 2/3 of the time we have a pediatric resident that's going through their general pediatrics training here in Southern Nevada who rotates with us. I'm married to Bonnie, who's been tolerating me for 28 years. We have the distinction of getting married 2 days after I graduated from medical school. We have 2 great kids, Elena, who's 25 years old and is in her 3rd year of being a first grade teacher in a local elementary school here in Southern Nevada. My younger one, Zoe, is a sophomore at University of Nevada, Reno. I always joke with my wife that I'll probably be dead for 4 years before I actually retire. I'm hoping in the next 10 years to be still here in Southern Nevada and doing what I do. Hopefully recruiting more help so that we can provide more and better service.